Welcome back. How were the breakout sessions? Good? Energized? All right. I did see for the first time attending events, I love in the courtyard, the folks who had the headphones on to sort of be able to focus while everyone else is talking. That was fascinating. Well, I'm Trooper Sanders. I am CEO of an extraordinary organization called Benefits Data Trust. As I speak, my extraordinary colleagues are talking to people all across the country, helping screen and helping them apply to get health care, food assistance, deal with federal financial aid. I have other colleagues who are working with government leaders and public servants in blue states, purple states, red states, trying to make our social safety net be a bit more effective for those in need. And it's an honor to be here to help facilitate this panel on people and planet. Now, you may be wondering why, as someone whose day job is about Medicaid and SNAP and federal financial aid, part of a panel around climate change. And the big part is that, as we all know, as important as the health of our planet is, we're all a little bit self-interested because it's about the health of each and every one of us. And unfortunately, over the past generations, we have not done the work to stop and reverse climate change. And we find ourselves at a place right now to both need to not only double, but triple and beyond down on arresting climate change, but really give real focus to how it is going to bite each of us, and particularly affect the lives of those who are traditionally excluded and marginalized and face issues in health and education and other things. And so it's really about blending the worlds of climate and justice, economic opportunity, public health into one national and global response. As we think about climate change, we should also keep in mind our neighbors, our families, our friends, and those who we don't know, who today have health conditions such as asthma that are going to get worse. Folks who work every day and need to go outside to earn their living where it's going to be too hot to work, and they won't be able to put food on the table. We need to think about the known unknowns of what additional health issues will be exacerbated by climate change, and really marshal the attention and time and resources ahead of the effects to respond to it. And so I come to you today with an $80 billion opportunity. Over the past, 3-4 generations since the Great Depression, and I'm going to speak parochially about the United States, but of course this is a global matter. The United States has built a social safety net. We can have a vigorous debate about whether it's enough or not designed right, but there is a social safety net with healthcare, education, other opportunities. And for many people, these programs work. They save lives, they improve economic well-being. There may be people in this room who've gone through school because of that social safety net. In addition, this is a pretty well-heeled group. And so many of you may think, well, that doesn't have anything to do with me. Well, let me think about the parent that you have who's on Medicaid and Medicare or SNAP, and you're able to be at places like this because they get the help that they need. Unfortunately, because these programs are so complicated and in many cases so off-putting, we leave money on the table. So every year, $80 billion worth of these programs are left on the table. And I would just like to leave everybody with a challenge who thinks, how hard can this be? I don't care how many degrees you have, how many business deals that you've done. I will defy anyone here to fill out a Medicaid application without breaking down in tears. It is hard. And so think about the people who are going to be affected as climate change bites. And this is what you have to deal with. Complicated forms. You have to drag your child to an office monthly to prove that they're there and they're still alive and eating. So can I get a few bucks to pay for groceries? All sorts of archaic rules. There's stigma and shame around this. So imagine You can't breathe because of climate change. You can't go to work. You're trying to make sure you can keep life together, and you have to deal with this sort of nonsense. It really doesn't have to be this way. And that's what Benefits Data Trust is about changing. We're working with public servants all across this country. We're working with different sectors, such as healthcare and higher education, to create the type of social safety net that we would all want. And frankly, and I'll make some assumptions, let's assume everyone here is relatively fortunate, even different economic levels, but relatively fortunate. Think of all the types of help that we get that's easy. Who owns a home? Who takes the home mortgage deduction? Guess what that is? Welfare. It's welfare. How hard is it to claim? Besides doing your taxes and your bank deals with all the details, it is easier for someone to get welfare owning $1 million home than it is for a busy mom with a child to get $100 to buy groceries. That's what we need to change. And that is the opportunity as we're thinking about adapting and preparing for climate change, as we're trying to stop it. We need to put this $80 billion to work again within our climate strategies. Every state, every community that is thinking about climate change and how they're going to support their communities, they need to bring their Medicaid directors, their SNAP directors, all of the folks running these social safety net programs around the table to build a comprehensive approach. And we really think that really over the next number of years, we can not only meld our social safety net with climate justice and equity and adaptation, but we can save lives, we can save our healthcare system money, we can improve our economic growth because more people will be able to keep mind and body together and participate. And so I invite everyone here who's into the environment to come talk to us who deal with food stamps and Medicaid. Thank you so much.